Hello, everyone, and welcome to my first medical oncology doodly. This is meant to be basic medical oncology education, ideally designed for patients and their families, but I really do think that healthcare providers can get something out of it too. Remember, this is educational and not meant to be medical advice. Today, I want to talk about breast cancer pathology and specifically the differences between invasive and non invasive disease, which is the first step in deciding what to do. So, let's look at a breast microscopically, which is made of lobules. These make milk, and then the milk is channeled through the ducts, which travel to the nipple and feed the baby when the appropriate time is right in a woman's life. Cancer cells, remember, make copies and copies and copies of themselves. If the lobules contain the cancer cells, we call that lobular carcinoma in situ. The cells don't break through and can't invade into blood vessels or lymph channels. If the cells are in the ducts, but they stay in the ducts, it's similar. We call it ductal carcinoma in situ or at the site. Again, this is non invasive cancer, which generally has a much, much better prognosis. Now, if those lobular cancer cells get big enough and break through the membrane of the lobule, we call that invasive lobular carcinoma. These can get really big. If the cells are in the ducts and they break through the membrane, we call that invasive ductal carcinoma. This is probably the most common form of invasive disease. The problem with invasive disease is once those cells break through those membranes, they can get to the lymphatic channels where the lymph nodes can then be infected with cancer cells. The lymph nodes are the on ramp to the rest of the body. In summary, then, there's two main types of breast cancer: non-invasive disease, or in situ, which is Latin for meaning at the site. There's LCIS. LCIS is generally treated with surgery only. There's no need for radiation or for further systemic therapy. DCIS is surgery because you've already had it, followed by radiation. Then there's invasive disease, which is much more dangerous because it has the potential to travel to the lymph nodes. Lobular and ductal invasive cancers are basically treated the same, usually with surgery, often followed by radiation and some form of systemic therapy. I'll outline more of these in future videos. Thanks for watching Oncology Whiteboard.